necrotizing sialometaplasia is a non-neoplastic inflammatory condition of the salivary glands. So it is not a tumor. So what is the other names for this necrotizing sialometaplasia? It is otherwise called as your salivary gland infarction or a reactive self-resolving condition. Reactive self-resolving condition. Why is the name necrotizing sialometaplasia? The name itself indicates necrotizing. It undergoes necrosis. Sialometaplasia. Sialo means involving the salivary gland. Metaplasia is transformation of one cell into another cell. So the salivary gland undergoes metaplastic transformation. So necrosis followed by metaplasia of your salivary gland. Basically your salivary gland ducts. So that's why it's called as necrotizing sialometaplasia. Moving to the etiology. It is because of the ischemia of the salivary gland tissues. Basically it is because of any result of any ischemia, that is ischemia of the salivary gland tissue, or it's otherwise your local infarction which can cause this. So what are the factors which causes this local infarction or the ischemia? The predisposing factors are the traumatic injuries to the area, dental infections, ill-fitting dentures, upper respiratory tract infection, adjacent tumors, any previous surgery, and continuous usage of your tobacco. So these are the predisposing factors which can lead to your infarction or leading to ischemia, to necrosis, followed by your metaplasia. So these are the predisposing factors and the etiological factors of your necrotizing sialometaplasia. So basically what happens here? If you take your necrotizing sialometaplasia, it has been divided into 5 stages. So it undergoes 5 stages which was given by Anirudh and Hansen. So it undergoes 5 histological changes. So what are those changes? The first change is your infarction or the necrotic stage. The second stage is your sequestration stage. The third is your ulcerative stage. And the fourth is your reparative stage. And fifth is the healed stage. So these are the 5 pathological changes which happen in your necrotizing sialometaplasia. So starting with the first stage, your infarction or the necrotic stage. So what happens here? What happens here is because there is an occluded blood vessel, that is your infarction. So because of this occluded blood vessel or the infarction, what happens is the surrounding salivary gland tissue undergo necrosis. The glandular tissue, that is your salivary gland cells, the acina cells and the ductal cells undergo necrosis. Only in that particular area only. The surrounding salivary gland tissues will be normal, because in those areas it is not supplied by only that particular blood vessel. It will be supplied by multiple areas. Only in that particular area where it is supplied by this occluded blood vessel, those areas will undergo necrosis. So this is the first infarction or the necrotic stage. The next is your sequestration stage. So what happens in this sequestration stage? In the sequestration stage, there will be sequestration of the necrotic tissue. There in the previous stage, that is your necrotic stage, there was necrosis which was formed of your glandular tissue. So this glandular tissue will get sequestered, will be thrown out. So what happens here? The epithelium above this, the necrosis, if you know, the glandular tissue will be there in the connective tissue only. So the epithelium just above this will slightly elevate above. When it elevates, what happens? These necrotic tissue will be pushed up towards your epithelium. In this stage, clinically it will have a swelling. The patient will complain of a swelling because this necrotic tissue will be pushing your epithelium upwards, leaving behind the remaining glandular tissues and your ductal system and the occluded blood vessels. So only the necrotic tissue is thrown out. It's just moving up towards your epithelium, thereby lifting your epithelium. Now the third stage, the ulcerative stage. The name itself indicates when this necrosis is pushing the epithelium up, the epithelium gets sloughed off, you get an ulcer. So the necrotic tissue is expelled out, causing an ulcer in that particular area. So you see a crater-like ulceration in this clinically. On clinical examination, you will be able to appreciate a crater-like ulceration. In the connective tissue area, you will be able to appreciate the surviving glandular tissues, that is your acini as well as your ductal cells as well as your occluded blood vessels. Next is your reparative stage. So what happens in the reparative stage? In the previous stages, first initially it was a necrosis because of the occlusion. Next what happens is necrosis pushes the epithelium above and then expels out, thereby creating an ulcer. So then now it is going to repair. So what happens right now, what will be there is you will be able to appreciate one ulcerated epithelium on top. In the connective tissue portion where the necrosis had occurred, the necrotic tissue has been thrown out, but the remaining ductal epithelial cells and the remaining glandular acini will be present along with the blood vessels. Now what happens is the epithelium will try to heal by itself. So when this epithelium heals, what will happen is it will proliferate more because of the reactive process. So it will proliferate down towards the ductal epithelium or the ducts of your salivary gland. Now what happens is this ducts of the salivary gland will undergo squamous metaplasia. They will turn into a undergo metaplasia to form the squamous cells. So you will be able to appreciate islands of these squamous metaplastic cells in the form of either epimyoepithelial islands, or sometimes it will resemble like a mucoepidermoid carcinoma. I'll discuss this later in case of your histopathology. So what happens basically here is there will be downward growth of the surface epithelium. Along with that, the ductal epithelium will proliferate and will undergo metaplasia. So both these together will form an island. So you have a ductal epithelium which has undergone metaplasia to form a squamous island, surrounding which you will be able to appreciate the proliferating overlying epithelium. So this will surround these squamous metaplastic ductal cells. So it will resemble like an island. So this is what happens in your reparative stage. The overlying epithelium proliferates. Along with that, there is metaplasia of the ductal cells also. Next, last stage is your healed stage. In your healed stage, what happens is there will be remaining necrosis. Here and there some necrosis or necrotic tissues are there. They will be phagocytosed by the histiocytes and the neutrophils. That is the final healing stage. So these are the pathogenesis or the 5 stages of your necrotizing sialometaplasia. The first is your infarction or the necrotic stage. Second, the sequestration stage. Third, the ulcerative stage. The fourth, the reparative stage. And the fifth is the complete healed stage. Now moving to the clinical findings. It is usually a lesion involving the minor salivary gland. Very rarely it will be involving the major salivary gland. If it involves the major salivary gland, the parotid and the submandibular gland are the commonly affected. In case of your minor salivary gland, the most commonest site is your palate. So palate is the commonest site of occurrence of your necrotizing sialometaplasia. It can also occur in other regions of the minor salivary gland, such as your retromolar area, the buccal mucosa, the tongue, the incisor canal area and the labial mucosa. Sometimes it can also be seen in case of the mucous glands in the lung, the nasal cavity, the trachea, the larynx, the nasopharynx and the maxillary sinus also. These are the other sites in which you will be able to appreciate your necrotizing sialometaplasia. And if you see, it is usually involving the 4th decade of life and equal sex predilection. So there is no specificity for either it's going to be a male or a female. So equal sex predilection is going to be there. Any one can be affected with this in the 4th decade of life. So clinically how it will appear? We have seen the 5 stages. So what happens is in the initial stages where it was there in your necrotic or your infarction stage, clinically you will not be able to appreciate anything. In the second stage, where the sequestration stage, you will be able to appreciate a small swelling there, a non-ulcerated swelling with pain or paresthesia. So this is the first clinical finding. So only the second stage you will be able to appreciate clinically. Then after 2 to 3 weeks, what happens is the necrotic tissue, that is the sequestration stage, what happens is it sloughs out. So the necrotic tissue sloughs out, leaving a crater-like ulcer. So you will be able to appreciate a crater-like ulcer 1 centimeter to 5 centimeter in diameter without any pain. So this is the clinical finding in the initial stages. In the healing stage, is normal. You will be able to appreciate a normal healed surface mucosa. And usually it is seen in the unilaterally, and sometimes the palatal bone can get eroded because it's very deeply placed. The palatal bone, because of this reactive process, can get eroded. This is the early lesion where you are able to appreciate a small dome shaped swelling in the left side of the palate. This is the crater like defect which you will be able to appreciate in the third stage.